We're almost at the end of our day, and back by popular demand, we have Ryan Allison, also part of our team at Ventures. He's our portfolio manager, and he's got some great stuff to share with all of you, including some of the great work around our Medtech Flyers program, which we launched last year for the first time. It's a joint program, both supported as from a programmatic standpoint as well as from a funding standpoint, where our caregivers have the opportunity to submit their innovation idea. It has to be around a product or Medtech device product framing. And for the full year, we explored, experimented, poked, and found ways to support our caregivers. And we've got 3 ideas that have really matured in the past year that Ryan will speak to. We also have today unveiling for the first time our 2022 winners, and we also have an award for our 2021 winners for the great work that they've done. I'm going to pass the mic to Ryan, and once he gets going, I'm going to ask Dr. Dan Simon to join me over there, as we've got some pretty beefy awards that we want to give out to our awardees. Ryan, thank you.
All right. Thank you, Kip. Good afternoon, everyone. I'm Ryan Allison, Portfolio Manager at Ventures. So I thought it would be good to remind everyone what Medtech Flyers is all about and how we work with Dr. Simon and Fritz and the Research and Education Institute. So as you've heard all day, well, at least during the afternoon portion, Ventures is the technology commercialization and investment arm for university hospitals. So we actively source and develop internal concepts for medical devices, software, and new service design models. So when you make an invention disclosure, it first comes to us, and we give it a round of diligence to understand the market opportunity, the clinical unmet need, and figure out if there's a commercial pathway to pursue. We also work with outside companies, as you've seen, like Exploro and MetaView, who are early in their product development stages and really need an environment to work with them to develop and test their product. So we work with companies who are a good fit within our hospital system. And we have investment resources for investing capital into early stage companies seeking to build out their businesses and products. We've invested in both outside companies as well as supported our own spin-outs. So just like as you've seen with Hemaptics in the prior session, we're focused on supporting our spin-out companies so that they can get to market and start helping patients sooner. So one of the main ways we work with the Research and Education Institute is by working with many of our clinician scientists who have ideas and are conducting research and need a way to commercialize or explore the commercial potential for their research and their inventions. So we've been receiving more invention disclosures over the past 2 years than our historical average, which means that a lot of you are creating great work. A lot of you are engaging with us with your ideas. And through events like this, you can see that there's real promise and opportunity to help drive your ideas forward. So we also work closely with CWRU's School of Medicine and Tech Transfer Office on shared intellectual property, which is also rising. And so we've got a great relationship there. And we continue to nurture and support those shared inventions along their commercial pathways. So as you'll hear in a little bit, one of the key foci lately between our groups is how we give life to medical device concepts. Our institutes conceived of the Medtech Flyers program last year, in which we devoted proof of concept funding for early medical device ideas to advanced development of prototypes. We are grateful for the support and expertise of Dr. Simon and his team to help us assess the projects and strategize on how to best de-risk them for the market. So Medtech Flyers is designed to give lift to ideas and concepts that need early support for development and that have a clear pathway for impacting patient care and clinical tool sets. It's this funding gap that we usually seek to address, which is there's usually a dearth of funding capital at this stage. So if someone has an idea, what do they do next? How is it supported? Maybe it's not quite right for research funding, but if only there was a way or some funding available to just test it out if it's a good concept. Well, that's where Medtech Flyers fits in, and hopefully we can see some of these projects advance through the stages of commercialization and perhaps even explore our TVSF funding opportunity, similarly to Hemaptics. So, of course, we also choose projects that can quickly navigate a pathway to commercialization, which might mean that it could be rapidly prototyped. It has a pretty easy regulatory pathway, and could all be done at nominal cost, which is where I think, as you'll see with some of the ideas that we'll show to you today, you'll see that we focus on things that can be prototyped quickly, efficiently, and getting to that next critical milestone step. All right, so let's roll into the award presentations for last year's 2021 winner cohort. These teams have made considerable progress this year in prototyping and testing their concepts, as well as trialing new technology and engaging with an outside party to explore a potential co-development opportunity. However, these teams are still in their journey of product development and working through key milestones towards commercialization. So we won't have any presentations by the teams due to wanting to protect the nature of the proprietary technology and mitigate risk of public disclosure of information. Regardless, I think you'll appreciate the work that they've been doing, and we'll have a chance to meet some of the inventors on these teams this year. Okay, so our first team is represented by Dr. Ava Johnson. Ava, could you please come up? Dr. Johnson is from the Biofeedback to Go team, whose idea was to solve for bringing biofeedback therapy closer to the patient's home instead of in the clinic. This team is exploring some existing technology that has the potential to be co-opted and co-developed for the pediatric therapy at-home use case. Dr. Johnson, thank you for your commitment to innovation at UH, and congratulations. Okay, and next up we have Colin Drummond from CWRU representing the Smart Dilator team, which also features Adonis Sajaz and Shubham Gupta from UH's Department of Urology. Their concept was to improve upon the status quo seen with current available vaginal dilator medical devices. The team worked with an outside design and engineering firm to build upon Colin's great prototyping work to start off the project. Having solved some of the technical aspects of the design, the team is now positioned to explore prototype refinement, testing, and research in this underserved area of women's health, and is now preparing for additional funding opportunities to support the project. Colin, thank you to the team for your commitment to innovation, and congratulations. Okay, so our third team, unfortunately, no one was able to come, but that's all right. We could always happy to recognize, and clinical duties take priority. This team is called the Robotic Port Sleeve Team, and it featured doctors Jeff Marks, Amitabh Chak, Steve Shomish, and a couple team members who have since left UH, Ryan Yuza and Dan Hashimoto. The team has been assisted by a design and engineering firm to help prototype their device concept aimed at preventing port site migration and tissue interference during laparoscopic and robotic surgeries. Currently, the team is up to their third generation prototype and scheduled for some benchtop and animal testing later this month. So they've been able to move very rapidly and efficiently with also a local design firm that we've recently engaged with. So congratulations to the Robotic Port Sleeve team. Okay, so now we get into our 2022 Medtech Flyers winner announcements. It's my pleasure to introduce our second annual Medtech Flyers winners whose projects were selected for funding up to $25,000 to help prototype and develop new medical device concepts from individuals in interventional radiology, general surgery, and neurosurgery. These inventors will engage closely with us over the next year as we work to plan for and support project milestones for their technologies along the earliest stages of commercialization. And of course, for inventors, clinicians, anyone with an idea, if you've happened to miss this round, there will be future funding opportunities to participate in. We intend to open up another round of submissions starting in the summer next year. And even if you want to jump on something sooner than that, you're always free to engage with us. We're happy to hear your ideas. If you've prototyped something, that's great. If not, if you just have a sketch or a couple sentences description, regardless, please just reach out to us and we can help evaluate and figure out next steps. All right, let's get into our Medtech Flyers winning projects. This year, we aren't having the winners present, but I'll briefly highlight the unmet need that's the focus of each winning submission. Our first awardee is Dr. Salim Aboud, an interventional radiologist who has a novel medical device concept to optimize chest ports. For a little bit of background, implanting a chest port requires moderate sedation, chest pocket creation, an hour of interventional radiology time, an hour recovery period for the patient, and incision dressings or Steri-strips to patch up the wound afterwards. His concept could potentially cut procedure time in half, from 1 hour to 30 minutes, while being easier for staff to complete, plus improve patient experience, all without really changing or affecting the end patient care in the end. So after the chest port is implanted, nothing really changes. So we'll work with Dr. Aboud on his designs, conduct market validation to understand the size of the opportunity, and survey the intellectual property landscape, and as well as begin and source design and engineering firm help that can translate his concept into a tangible prototype that demonstrates proof of concept. So congratulations, Dr. Aboud. Okay, next, I want to recognize Dr. Matthew Burstein, a general surgeon who has an idea for a new device that can improve procedure workflow and reduce dependency on the tools needed during anastomosis procedures that use circular staplers. Laparoscopic gastric bypass using a circular stapler for gastrojejunostomy anastomosis creates a risk of surgical site contamination and requires 2 to 3 extra surgical tools. So metal dilators, wound protectors, and endo-catch bags create extra cost and add time to the procedure. We'll work with Dr. Burstein to advance his idea through the internal market validation step and quickly begin to source and prototype his concept based on its elegant simplicity, which we can't show yet. We can possibly test this concept beyond a benchtop model to demonstrate proof of concept. Congratulations, Dr. Burstein. And finally, last but not least, is Dr. Brian Rothstein, a pediatric neurosurgeon who has an idea for a novel medical device concept that may provide a better way to detect ventriculoperitoneal shunt malfunction and cerebrospinal fluid flow rate. Just for background, pediatric hydrocephalus patients receiving a VP shunt are at risk of shunt failure, which is sometimes 30 to 40% over the lifetime. And typically, it can clog in the first few months following implantation. Current triage and diagnosis of shunt malfunction is difficult. It may require emergency department admission, MRI and/or CT imaging and X-rays, or tapping the shunt or other invasive exploration of the shunt to determine a true malfunction. Thus, it all comes at great cost and also adds a lot of complex, unnecessary workflow. Like the others, we'll work with Dr. Rothstein to begin designing and engineering a prototype for his concept that we can test in a benchtop model. So congratulations, Dr. Rothstein. And that'll wrap it up for Medtech Flyers. We're looking forward to working with this year's cohort, as well as continuing to support last year's. I know there's still a lot of work to be done, and we're really excited to explore the next step. Thank you.
I think about from start to finish, Dr. Jordan Winter's comment from earlier this morning saying there's a certain skill set in terms of the basic translational applied research, and there's also a whole nother skill set when it comes to bringing the product to life so that it could be scaled, commercialized, and taken out there into the world to make impact. And I think between morning and afternoon, we've seen quite a range of ideas and contributions, research and practice. Perhaps one more time, a round of applause for our afternoon speakers. And I did ask our organizers if it's okay to end earlier than scheduled, but we're going to have closing remarks from Quentin. Thank you.
I guess I drew the short stick and am tasked to conclude this event. I think all in all, this has been a very successful and amazing event. At its peak, I believe we had over 200 individuals tuned into our event. And hopefully this level of engagement continues next year and in the future as well. I want to thank all the presenters for their very engaging presentations, and also they stay largely on time, which is always fantastic for us to end early. Also want to thank our colleagues from the UH R&E office, UH Ventures, and UH Marketing for their tireless effort to organize and manage this event today. With that, I'm going to give you 15 minutes back for your afternoon, and hopefully we see you next year. All right.